Hey everyone, this is Sarah with RATIONALE.com, and in this video I'm going to be talking about the Next Generation NCLEX exam. So let's get started. The NCLEX exam is a licensing exam nurse graduates must pass in order to legally practice here in the United States, Canada, or Australia. And if you're a nursing student who's going to be graduating in the spring of 2023 or later, there are major changes coming up to this exam that you want to know about. So the National Council of State Boards of Nursing plans to release a new format of the NCLEX exam called the Next Generation NCLEX, or NGN for short. And they plan to release this new format on April 1st of 2023. Therefore, as you can see, unless this release date changes, if you graduate in spring of 2023 or later on, you will likely get this new format. So what is the Next Generation NCLEX exam and what exactly is changing? Well, one of the biggest changes with the Next Generation NCLEX exam is that there's a shift towards case studies. And case studies help assess the test taker's ability to think critically and simulate situations that they would encounter as a nurse. So a case study is a created scenario that could happen in the real world of nursing that tests the test taker's ability to handle a particular nursing situation. And the test taker is given information about a patient, their diagnosis, current assessment findings, medications, lab results, and a presenting problem. So based on this information, the nurse will be asked several questions on how they would respond or deal with that particular situation. Now this right here requires a lot of critical thinking and nursing knowledge and will test the test taker on how they would deliver good quality patient care. So on this exam, there will be 3 case studies with around 6 questions each for a total of 18 items in addition to other types of questions. Also, there will be 5 new item types on this exam, including the following: extended multiple response. So although multiple response items such as select all that apply questions are on the current NCLEX exam, extended multiple response will expand on the number of options for each question. Then there's extended drag and drop, and these question types require you to drag a response into one of the blank answer spaces, and test takers will now have to determine whether they should use some or all of the options available. Next is Cloze, also known as drop down, and these are drop down options that allow you to select a correct response, and there can be multiple drop down boxes in a Cloze type question. There's also enhanced hotspot, and this enhanced item type allows you to select relevant words or phrases from a sample medical record that corresponds to the question. And then lastly, matrix/grid, and this item type features rows and columns with options that the candidate must select. Now let's talk about scoring changes. So if any of that information I just covered makes you nervous, I have some good news. The Next Generation NCLEX exam is changing their scoring model to a polytomous scoring model, where they're going to give partial credit on questions that have multiple inputs. And this is actually different from the current NCLEX format that we have right now, where you get either full credit or no credit. And yes, that includes those dreaded select all that apply questions. So this exam will use 3 different scoring models depending on the question type. One type is the 0-1 scoring, which means you earn a point for each correct answer selected and 0 points when you select an incorrect option. The points are then added together for a total question score. Next is plus and minus scoring, which means that you can earn a point when you select a correct answer but lose a point when you select an incorrect option. And then lastly, there's rationale scoring, which means that you only earn points when you select a response that reflects a proper understanding of the rationale of the question. In this format, you will select the paired options that logically follow. So with all that said, how many questions are on the NGN exam? Well, there's a minimum of 70 and a maximum of 135. And the number of questions you receive really varies because this test uses computerized adaptive testing, which will continue giving you questions of different difficulty level based on how you answer the previous questions. So with this test, it'll keep giving you questions until it's about 95% confident that you've either passed, or failed. And of course, the test will shut off if you run out of time or you receive the maximum questions. And you have 5 hours to take this exam. Now, I know some of you are really stressed out about this new NCLEX format, but I really don't think you should worry about it at all, because the nclex-pn is not some evil organization with an agenda to torture nursing students with the fear of forever failing NCLEX. Instead, these individuals are professionals who want to ensure that you're equipped with the proper knowledge so that you can offer great care and succeed in practice. So how can you prepare for the NGN exam? Well, a lot of people are asking the question, what is changing with NCLEX? And it's great to know what changes are coming and how the questions will be formatted. And I do think that practicing questions with similar NCLEX format is very beneficial. However, I really wouldn't worry too much about these new NCLEX format changes, because if you really want to succeed on NCLEX, you want to ask yourself the question, what is not changing with NCLEX? And the fact is, the thing that's not changing is that they want to ensure that you know enough about nursing to think critically and to make the right clinical decisions so you can provide safe and effective patient care. So when you study, you want to make sure that you truly understand the material that you're going over and that you're not just memorizing facts. Because in these case studies, whenever they're giving you certain patient conditions with medications and assessment findings, you can pull back from your nursing knowledge of whenever you learned about these disease processes, you learned about their patho, which leads you to answer the questions of why they have these certain signs and symptoms, why you're doing these nursing interventions, and why these labs are crazy, and why are they on these medications. All of that just flows beautifully together and you can answer these questions. So if you memorize the facts, it's harder to really regurgitate that material back, but instead if you learn it to a point where you can just go and explain it to someone, then you truly understand it and then you can just answer these case studies with ease. So how do you do that? Well, first of all, you want to make sure that you start studying as soon as possible and that you prioritize your weak areas. I talked about before how you can assess your weaknesses and strengths through software and so forth. So you want to make sure that you see what those are and you target those. You also want to practice many NCLEX style questions. I would practice anywhere between 90 to 100 questions almost every day. In addition, go back and review questions and topics you keep missing. Look at the patho of those diseases on questions you miss. Look up the medications and their mechanism of action and so forth, and go back and study those important details. Also, switch between review lectures, textbooks, and notes when you're not practicing questions to help you understand the content from different sources. And in my review lectures, I always try to help you understand not only the way something is done, but the why something is done by going over the patho and the rationales for why we're doing this, so you can sear that in your mind so you can think critically whenever you have to take an exam or work in the real world. So if you take the time to truly understand this information, it doesn't matter if it's a hotspot question, a drag or drop, or 50 case studies. You can take that knowledge that you have collected over your time in nursing school, you can sift through it, and then you can just go and you can answer those questions correctly. So in conclusion, don't waste time worrying about the changes that's occurring to this exam. Instead, stay the course, put in the time studying, practicing questions, and if you do that, you're going to do great.